Check, check. Check one, check two, check, check.
Hey there, science fans! Imagine being able to see through solid objects, like having superpower vision. Well, that's what happened in 1895 when a German physicist named Wilhelm Röntgen stumbled upon something extraordinary. He was experimenting with cathode rays, which are streams of electrons, when he noticed something weird. A screen coated with a special material glowed even when the cathode rays were blocked. Röntgen realized he had discovered a new type of invisible ray that could pass through objects, including his own hand. He called them X-rays, with X standing for the unknown. This discovery was a game-changer, especially for medicine. Before X-rays, doctors had limited ways to see inside the human body without cutting it open. X-rays allowed them to peek inside without surgery, making diagnoses more accurate and less invasive. Röntgen's discovery earned him the first Nobel Prize in Physics in 1901, and it's not hard to see why. His accidental finding revolutionized healthcare and opened up a whole new world of scientific exploration. Talk about a eureka moment, right? Röntgen's X-rays quickly became an invaluable tool, allowing us to see the unseen and understand the human body in ways never before imagined. But what exactly are these mysterious rays, and how do they work their magic? Let's dive in and find out. So, what exactly are X-rays? Well, they're a type of electromagnetic radiation similar to light or radio waves, but with a lot more energy. Think of it like this. Imagine the electromagnetic spectrum as a keyboard. On one end, you have low-energy radio waves, like those used for your favorite tunes. On the other end, you have high-energy gamma rays, which are pretty intense. X-rays fall somewhere in between, higher in energy than visible light, but not as powerful as gamma rays. This high energy is what allows X-rays to penetrate objects that visible light can't. It's like trying to roll a marble through a fence. A low-energy marble or visible light would just bounce off, but a high-energy marble or X-rays could pass right through the gaps. Different materials absorb X-rays to varying degrees. Dense materials like bones absorb more X-rays, while softer tissues like skin and muscles let more X-rays pass through. This difference in absorption is what creates the contrast in X-ray images, allowing us to differentiate between various structures. Pretty cool, huh? It's like having a superpower that lets you see the insides of things. But how do we actually generate these powerful X-rays, and how do we use them to create images? Let's find out. Ever wondered how those X-ray machines at the doctor's office actually work? It's all about using electricity to generate these powerful rays, and then capturing their journey through your body. The heart of an X-ray machine is the X-ray tube. Inside this tube, electrons, those tiny negatively charged particles, are fired at high speed towards a metal target, often made of tungsten. Think of it like a game of atomic billiards. When these high-speed electrons slam into the tungsten target, they lose some of their energy. This energy is released as X-rays. It's like throwing a ball at a wall. Some of the energy goes into making the ball bounce back, and some of it goes into making a sound. These X-rays are then focused into a beam, kind of like a flashlight beam, and directed towards the area of the body that needs to be examined. A detector on the other side captures the X-rays that pass through, creating a shadow image of what's inside. The denser the material, the whiter it appears on the X-ray image because it blocks more of the X-rays. Bones, being dense, show up bright white, while softer tissues appear in shades of gray. It's like looking at a shadow puppet show with your bones casting the most prominent shadows. X-rays have revolutionized the way doctors diagnose and treat patients. Remember how we used to rely on guesswork or invasive procedures to figure out what's going on inside the body? Well, X-rays changed all that. They gave doctors a powerful tool to see inside the human body without having to cut it open. One of the most common uses of X-rays is to diagnose bone fractures. Whether it's a hairline crack from a sports injury or a more serious break, X-rays can reveal the extent of the damage and help doctors determine the best course of treatment. But it's not just bones that X-rays can see. They can also be used to detect lung infections like pneumonia, where the infected areas of the lungs appear cloudy on an X-ray image. X-rays are also used in dentistry to detect cavities, examine the roots of teeth, and assess the health of jawbones. They're even used to help guide surgeons during certain procedures, ensuring they're operating in exactly the right place. Talk about precision. Section 5. Beyond bones, other uses of X-rays. While X-rays are best known for their role in medicine, their usefulness extends far beyond the doctor's office. Think of those airport security checkpoints. Ever wonder how they can see inside your luggage without opening it? You guessed it, X-rays. These security X-rays use a lower dose of radiation than medical X-rays, so they're safe for scanning personal belongings. But it doesn't stop there. X-rays are used in various industries to inspect the integrity of materials and structures. For example, manufacturers use X-rays to check for cracks or defects in welds, ensuring that bridges, airplanes, and other critical structures are safe and sound. Talk about an important job. Even art historians rely on X-rays to examine paintings and sculptures. X-rays can reveal hidden layers of paint, identify artists' techniques, and even uncover forgeries. It's like being a detective of the art world, uncovering secrets hidden beneath the surface. Section 6. The dark side of X-rays. While X-rays have brought incredible benefits to medicine, security, and other fields, it's important to remember that they're not without risks. Remember those high-energy waves we talked about? Well, too much exposure to X-rays can be harmful to living cells. Think of it like sunbathing. A little bit of sun can be good for you, providing vitamin D, but too much sun exposure can lead to sunburn and increase the risk of skin cancer. Similarly, while low doses of X-rays used for medical imaging are generally considered safe, high doses or prolonged exposure can damage DNA and increase the risk of developing cancer. That's why it's crucial to use X-rays responsibly and take precautions to minimize unnecessary exposure. We'll discuss these safety measures in the next section. Section 7. Staying safe with X-rays. So, how do we enjoy the benefits of X-rays while minimizing the risks? It all comes down to using them judiciously and following safety guidelines. When you get an X-ray at the doctor's office, you'll notice that they often cover you with a lead apron. Lead is very dense and absorbs X-rays, so it acts as a shield to protect your organs from unnecessary exposure. Think of it like wearing sunscreen for your insides. X-ray technicians who work with these machines regularly also take precautions to minimize their exposure. They typically operate from behind a protective barrier or wear lead-lined garments to reduce their risk. It's like wearing a suit of armor against invisible rays. The good news is that modern X-ray machines are designed to deliver the lowest possible dose of radiation needed to produce a clear image. Additionally, doctors carefully consider the risks and benefits before ordering an X-ray, especially for pregnant women and children who are more sensitive to radiation. Section 8. Weighing the benefits and risks. Like any medical procedure, using X-rays involves weighing the potential benefits against the potential risks. In many cases, the benefits of obtaining a diagnosis or monitoring a medical condition far outweigh the small risk associated with the radiation exposure. For example, imagine you've injured your leg and the doctor suspects a fracture. An X-ray can quickly confirm or rule out a fracture, allowing for prompt and appropriate treatment. In this case, the benefit of a quick and accurate diagnosis clearly outweighs the minimal risk from the X-ray. Doctors also consider alternative imaging techniques, such as ultrasound or MRI, which don't involve radiation. However, X-rays remain the gold standard for certain diagnoses, especially when it comes to bones. It's all about choosing the right tool for the job. Section 9. The future of X-rays. Since their discovery over a century ago, X-rays have become an indispensable tool in medicine, security, and beyond. But the story of X-rays doesn't end there. Scientists and engineers are constantly working to improve X-ray technology, making it even safer and more powerful. One exciting area of development is the use of artificial intelligence to analyze X-ray images. AI algorithms can help radiologists detect subtle abnormalities that might be missed by the human eye, leading to earlier diagnoses and better treatment outcomes. Another promising area is the development of new X-ray detectors that are more sensitive and require even lower doses of radiation. This means clearer images with even less risk to patients. Talk about a win-win situation. As technology continues to advance, we can expect X-rays to play an even greater role in healthcare and beyond, helping us see the unseen and unlock the mysteries of the world around us. And that's pretty awesome.